name is Christian Aguilar, and in this video I will be presenting the corrective exercise techniques final project. So for this project I decided to evaluate and assess Eric Vasquez. Unfortunately my client never became available to finish recording the last portions of the footage that I needed, like the introduction, among other things. But to introduce you to Eric, he is a Hispanic 23-year-old male who is a U.S. Army veteran, and he got medically separated due to an injury sustained on his right shoulder. So on this shoulder he actually had to have surgery performed, so for some time he was unable to perform any exercises or difficult tasks on that side of his body. This surgery did happen around 2 years ago. So so in actuality, he is an overall fit and active person. Eric is 5 foot 8 inches and he weighs about 155 pounds. He goes to the gym 2 to 4 times a week, and he's actually able to exercise his entire body now. So he's doing much better than he was 2 years ago. He also likes to play basketball in his spare time. Now his main fitness goal is to gain a few pounds of lean muscle mass and to just stay healthy and stay fit and as active as he can. The assessments chosen to perform on Eric were the static postural assessment, of course, the overhead squat, the push and pull assessment, the overhead dumbbell press, the Davies test, and the depth jump assessments. I decided to go with these assessments because I believe they would be the best for a young and fit male like Eric is. And specifically for him, the overhead dumbbell press and the push and pull assessments I believe are to be the most important ones for him, due to his history of his right shoulder surgery and his past issues. For the next few minutes you will see the assessments that were performed on Eric, and I will be pointing out any muscle imbalances or posture malalignments. We have here the static postural assessment. We can see that on the foot and ankle he has a slight external rotation, more on the right foot than the left foot. We can observe that the knees are neutral, the pelvis is level, the hips are neutral, the shoulders are level, but we can see that the head tilts slightly to the right. From the lateral view, we see that his foot arch is neutral. We can see that the lumbar spine has a normal curve, and although his shoulders are level, he does have a slight forward round. His thoracic spine has a normal curve also, and his head goes slightly forward. From this view, we can see that the lower leg is vertical, the knees are neutral, and the pelvis is level. Also, the hips are neutral and the shoulders are level. And for the gait assessment, we can see from the anterior view that his feet are slightly externally rotate. His knees are neutral and there's no asymmetrical shift noticed. There's also no pelvic tilt. His shoulders do roll forward here in the lateral view, and we can also see his head leaning forward. Next is the overhead squat assessment, and from the foot and ankle we can see that his feet turn out a bit. They also supinate. We can also see some knee varus. From his lumbopelvic hip complex, no asymmetrical shift is noticed. There are no pelvic tilts and no trunk lean. from the shoulders and thoracic spine, there is no scapular elevation, and the arms do not fall forward. And from the head and cervical spine, we see no forward head lean. Here we see the overhead dumbbell press, and from the lumbopelvic hip complex, we see no pelvic tilt. From the shoulders and thoracic spine, we see no scapular elevation, the arms do not fall forward, and we see no forward head lean. Here we have the push assessment, and we can see that in the lumbopelvic hip complex, there is no pelvic tilt, no trunk rotation. The shoulders and thoracic spine, there's some scapular elevation, but no scapular winging, and there is no forward head lean. For the pull assessment, we see no pelvic tilt, no trunk rotation, no scapular elevation, and no scapular winging, with also no forward head lean. We see here now the depth jump assessment, and from the foot and ankle we see no excessive pronation. The feet do turn out, but there is no asymmetrical contact or landing. From the knee, there is no valgus, there is some varus noted, there is some knee dominance noticed, and there is a stiff landing on the second jump. From the lumbopelvic hip complex, we see no asymmetrical weight shifts, no pelvic tilt, and there is some forward trunk lean noticed. Lastly, we have the Davies test, and from the lumbopelvic hip complex, we see no anterior pelvic tilt, there is some posterior pelvic tilt, and there is excessive trunk movement noticed. From the shoulder and thoracic spine, we see some scapular elevation, no scapular winging, and from the head, we see some forward head lean. After conducting all these assessments, I can notice that my client seems to be exhibiting most of his issues on the muscles of the shoulders, the upper back, and the neck. I created a short and simple program based on the corrective exercise continuum that focuses on the aforementioned regions of my client's body. For the inhibiting phase, my client will be manually using a myofascial roller on the pectoral muscles for 60 seconds twice in order to reduce tension and activity of these overactive tissues. In the lengthening phase, my client will focus on static stretching the overactive pectoral muscles. He will hold these stretches for 30 seconds twice on each side. On the activate phase, my client will then proceed to activate his underactive muscles, which includes the longus capitis, the longus colli, the rhomboids trapezius, teres minor, and the infraspinatus. He will activate these muscles by retracting the scapula as he contracts it. He will also horizontally abduct his shoulders in a controlled manner, contracting them in the process. Also, neck flexion will be used in this phase. For the activate phase, my client will perform a variety of resisted rowing exercises, including face pulls, which is done with a rope. He will also be performing resisted shoulder horizontal abductions, which are also known as rear deltoid flies, and along with more neck flexion exercises. And this concludes my video. I hope you enjoyed it, and thank you for your time.